during the week, precisely June 24th, which was on Tuesday, 2025, the Ondo State Contributory Health Commission clocked 6. So it's been 6 years of impact. It's been 6 years of work from the hand of the Ondo State Contributory Health Commission. So let me just give us a brief lowdown.
Okay.
So the ODCAC was launched June 24th, 2019. So what we have done over the years is that we have come up with different health insurance schemes, different health insurance products, to the end that people in Ondo State can have quality health care at little or no cost. So what we have done, we started with the Abiyamo scheme.
Okay, talking about the schemes now,
yes,
under ODCAC.
So the Abiyamo scheme is the state-owned equity scheme targeted at the vulnerable. Let me state clearly that the Abiyamo scheme is 100% funded by the state government.
100% funded by the state government.
So the premium is paid to ODCAC, and then we are able to go on with the process. So what Abiyamo scheme covers: pregnant women, vulnerable pregnant women, and children under 5. So what it does is, what we do is the client goes to the facility, to 9 specific facilities that we have accredited across the 3 senatorial districts of Ondo State. I will list the 9 much later. The client goes there, visits the facilities with the card BIO, which is issued by SITA, the state-owned State Information and Technology Agency.
Okay.
So, that card BIO is to ensure that the people that are accessing this care are indeed residents of Ondo State. So that people from other states do not come to enjoy what is meant for Ondo State residents. So, they visit the facility, the 9 hospitals, any of the 9 hospitals, and then they are accredited. They are enrolled to be able to enjoy these services. And what does Abiyamo scheme, what does it cover? Abiyamo covers antenatal services for the mom, that is for the pregnant woman.
Yes.
It covers delivery, even if cesarean section is needed.
Okay.
It's still covered at no cost. It also covers neonatal care for the child up to the first 30 days of the child's life, and up to 5 and treatment of common illnesses up to 5 years of the child's life.
That particular child.
Yeah, that particular child's life. So Abiyamo, that's what we have done so far. The 9 accredited facilities, I said I was going to mention it earlier.
Okay.
The 9 accredited facilities for Central, is Unimed, University of Medical Sciences Teaching Hospital, Akure Complex. We also have the former Mother and Child, which is now referred to as State Specialist Hospital, Kiara Akure, is also another accredited facility. In Ondo City, we have University of Medical Sciences Teaching Hospital along Laje Road, Ondo. We have University of Medical Sciences Teaching Hospital, Ondo Complex, the one they usually refer to as Mother and Child in Ondo. In the South, we also have, that in Ondo South, we also have General Hospital Ibokoda, we have General Hospital Ore, we have State Specialist Hospital Okitikpupa, and then for Across North, we have for Ondo North Central District, we have State Specialist Hospital Ikariakoko and General Hospital Owo. So those are the 9 accredited facilities that have been accredited for Abiyamo services so far. And so far we've had very incredible stories. So far we've had over 55,557 beneficiaries under the Abiyamo scheme. We've also had about 436 twin deliveries over the years. We've had 11 triplets and we've had 2 quadruplets under the Abiyamo scheme.
That's amazing.
At no cost.
Okay, I'm talking about still on the Abiyamo scheme. Is it only children who were born by registered mothers that are entitled, or if a child is under 5, he or she can still go to these facilities and still be entitled to these healthcare services?
Yes, if you're under 5, you can go to the facilities to access care under the Abiyamo scheme, so that you're covered for treatment of common illnesses in children, less than 5 years.
Less than 5 years. Okay, so moving on, what's the other scheme?
So we went ahead to the Basic Health Care Provision Program, the BACPP program. Of course, we have codenamed it Ilera Loro, so that people can indeed, relate with the name. Yeah,
okay.
BACPP sounds a little more cumbersome. So the Ilera Loro scheme is co-funded by the federal government and the state government. So 1% of the consolidated revenue fund is pushed into healthcare by the federal government, and then the state government also co-funds it, to the end that vulnerable population. So BACPP Lera Loro is for vulnerable population people.
Okay.
So we have, over the years, we have targeted sickle cell warriors. We were at Ondo City on Saturday. Last Saturday, we were at Ondo City to even enroll more sickle cell,
and create more awareness,
and create more awareness of sickle cell and the scheme. So we enrolled them. Before that enrollment, we had about 405 sickle cell warriors already
registered
under the scheme. We also have people living with disabilities also under the scheme. We have about 2,517 of people living with disabilities registered under the Ilera Loro scheme. We also have, so far we have about 82,000 people, over 82,000 people registered under the Ilera Loro scheme.
How often do you go for sensitizations under this scheme?
So we create awareness, we make posters, we do social media, post to ensure that people are aware of the Ilera Loro scheme. Well, the BACPP program is actually exists all over the country because the federal government funds it.
Okay.
Yes. With the state government in this particular case.
Yes.
So the gateway, the entry point for the BACPP program, the Ilera Loro program, let me just keep using Ilera.
Okay.
The Ilera Loro program, the entry point is primary health centers.
Okay.
So we use the Ondo State Primary Health Care Development Agency. We have collaborated with them. We have accredited 203 primary health centers
in the state.
Yes, across the 203 wards that we have. So we accredited one primary health center per ward.
Okay.
So that clients can access care, vulnerable clients can access care. I've mentioned sickle cell under the program. So far we've had a lot of success stories also under the BACPP Ilera Loro program.
Okay, so moving on to the big one, Oranghis.
So we went ahead because knowing that now we have covered vulnerable pregnant women and children, we have covered vulnerable population. What about other people that are not vulnerable? What about civil servants? What about people that work in the informal sector? So we went ahead and we launched the Orange Health Insurance Scheme for the formal sector. It was launched in 2022. In Akure here. So when we launched that program, the way it works for the Orange Health Insurance Scheme, Oranges formal sector, is that a certain percent of their salary is deducted as the premium. Okay. Usually from this is an automatic deduction from the release salary, and then that is remitted to us, and then the client comes, picks a facility, fills our enrollment form, picks a facility out of all the accredited facilities. We have about 68 facilities across Ondo State that have been accredited to, both private and government-owned facilities. So far we've had a lot of success stories for the BSc, for the Oranges formal sector. Okay. Presently we have about over 103,000 enrollees registered under the Orange Health Insurance Scheme, formal sector. We've had a lot of surgeries. We've had about 1,300 surgeries done for the formal sector. We've had renal transplants. We've had one renal transplant done under that scheme. We've had about 78 people on renal dialysis under the scheme. So we've had a lot of success stories, under the Orange Health Insurance Scheme formal sector.
How many percent is deducted from this premium?
So it's 3% of the gross salary of the civil servant, but usually that is co-funded. So there's a way it works. The government pays even the larger part of the 3%. The government actually pays 60% of that 3%, which is 1.8%. So the real deduction from the civil servant salary is 1.2%. So let's say civil servant earns 100,000, for instance. Our deduction will be 3,000. Government pays 1,008, and only 1,200 is exactly deducted from the client's salary. Although we are deducting 3,000, but that 3,000, 1,008 is already deducted from. So that is how it works. So for the formal sector, there is a way the government co-pays the premium. So you see that the government of Ondo State is actually doing a lot.
Actually doing a lot. Okay, so the Oranges scheme, it's divided into two, which is the formal and the informal sector. And we just talked about the formal sector and how the premium is being deducted. Now let's talk about the informal sector. This is is where lots of people want to know, okay, who are the people that falls under the informal sector? How is this premium deducted also, and how flexible is it?
So for the Orange Health Insurance Scheme informal sector, because after doing the formal sector, the formal statistics are shown in those states that those in the formal sector are about 1 to 4% of the population of residents of Ondo State. So the more population are in the informal sector, and informal sector people are people that do not get their pay from the state government.
Okay.
So these people are the Okada riders, the taxi drivers,
women,
the people that make their, or people in the organized private sector that they make, or they make their living on a daily basis. So those are the people that were. So we launched a scheme for them last year September at the Dome, launched by His Excellency Governor Lucky Orimiso Aiyedatiwa, and that is the Orange Health Insurance Scheme, Oranges for the informal sector. So that scheme, the way it works is we have developed 3 plans.
Okay.
So there is the individual plan. The premium for the individual plan is 18,000 naira if the enrollee is less than 60 years.
Less than 60 years,
so
18,000 naira.
18,000 naira per calendar year. That is 12 months.
Okay.
So for enrollees that are from 60 and above, the premium is 36,000 naira. 36,000 naira is actually about 100 naira per day if you bring it down. 18,000 naira is about 15 naira per day.
Okay.
That's how it works. So, but if you are more than 6 years, like I said, the premium is 36,000
naira.
Family plan is another plan. That's the individual plan that we talked about.
Okay.
And the family plan is a flat rate of 90,000 naira.
Okay.
Flat rate 90,000. You can add one spouse, yourself, the principal enrollee, and a maximum of 4 biological children less than 18 years. I should point out that the biological children, they have to be your biological children, and they have to be less than 18 years. Yes. So you can add them. So if you have one wife and one child, you can buy the family plan, because the family plan covers delivery, antenatal services, postnatal services. But if you buy the individual plan, I'm trying to tell you the difference. If you buy the individual plan, you do not get to enjoy maternal services, immunization for the child, because in this case it's no longer individual. So that's the difference between the individual
and the family plan.
So family plan is flat rate of 90,000. So if you have one wife, one husband, you can buy the family plan so that your wife can also enjoy the maternal and delivery services. If you have one spouse, yourself, and 4 children, you can still buy the family plan of 90,000 naira.
Okay.
So it's that way. You also have the association plan, which is even the more one that we're pushing for, because we're pushing for the 3 anyways, but because we want to get the numbers, we really want to get all residents of Ondo State covered. So we are trying to looking at the association plan. Of course, for associations there are going to be discounts. Premium might not be 18,000, 36,000. There will be discounts because you're coming as a group.
Okay.
So recently we were at Ritian, we have gone to NURTW. In fact, Ritian have enrolled some of them. The executives and some other members have already started enrolling into the scheme. So that is the more one that we are doing a lot of work. We are doing work all around, but that is the one that we're doing a lot of work on.
Okay, so now for a family that has more than 4 children, let's say 6 children, how can they come on board? Okay,
so if you have 6 children, I give a caveat that it's for people in the the number of children are 4. Okay, so if you have 6 children, you can either choose to buy a family plan, another family plan for them, maybe if you have a second spouse.
Okay.
Or you buy individual plans for the children.
Okay.
Or you just buy a family plan. Let's say you have 2 spouses, you're married, a polygamist, and you have 2 spouses, and then yourself, and let's say you have 7 or 6 children, like you mentioned, 6 children. So you can buy one family plan for yourself, one man, one wife, 4 of those children, and then another family plan, one man and the 2 children. That way, that second wife will be able to access maternal services, because if you choose to buy individual plans for the remaining 3 other dependents, if the wife should get pregnant, she will not be able to access maternal services.
Okay, because it's an individual plan and not a family plan. Okay, so how has the turn up been so far, the registrations? So far so good. It's been impressive. People have been, our people are out. We are trying to encourage people. Our phone numbers are there. Our website, you can also visit us on our website, www.odcsc.on.gov.ng.
.gov.ng. That's our website. So you can also visit us. Our phone numbers are there. You can chat us on the website. So far it's been impressive. People has been turning out. So what the way it works is, you fill the enrollment form, you make your payments. The agents that is discussing with you, we give you the the account number.
Okay.
Now the account number is not a personal account. I need to state again clearly that it is not a personal account. It's the account number of the Ondo State Contributory Rights Commission for the Oranghis, for the informal sector. You see it there.
Okay.
It's a UBA bank for the informal sector. So please do not pay into a personal account. Do not make hand-to-hand payments. Even if I come as a person, of course I won't come. If I come as a person and tell you to pay into my account
personal
or pay into
yes.
By hand, please do not receive any money.
Just be paid to the designated account.
Bank account.
Okay.
So once you make that payment, you attach the completed form to that payment receipt, and then you submit to us. We do our verification. There is a 60-day waiting period which we use to do those verifications, and they will produce an identity card for you. So you get an ID card, you get some other documents, frequently asked questions, you get our contact, so that it's easy for you to reach us in case you run into any problem.
Okay. So the ID card you're talking about, you said those ID cards will be taken to the facilities as a proof to show that you to identify with Oranghis. Okay, so now that brings us to, what if someone changes a location? Is it also very easy for the person to change the facility? Let's say you're moving from this local government to another local government. Do you have to just show your card that you are a member, or you have to do something else?
So if you change location and you need to change your facility, all you need to do is come to our office inside Ministry of Health Complex, beside Governor's office. Ondo State Contributory Rights Commission is the name. Visit our office and you fill a form.
Okay.
In which you will change your facility. That is the same way it works for the formal sector too.
Okay.
They visit there, they change, they write, they indicate, and they also sign. This is just to ensure that there are no issues such that it is clear that you are the one that required to change your facility. Requested to change your facility. So once you change your facility, the identity card can now change. The name on the facility can now change. But for the so let's say you pick UNIMED, University of Medical Sciences Teaching Hospital, Akure now. So that facility name will be printed on the
new card.
No, on the former. Initially, let's say you chose it initially.
Okay.
It will be printed on your card. So once you now decide to change facility, the new card, the new facility name will now be printed on the new card. But usually at your cost.
Okay.
Yes, it's usually at your cost for changing facilities. But initially, the initial payment, the initial facility you chose is covered. You don't get to pay for the ID card.
Okay, so for someone who probably has registered and has not fallen sick or fallen ill, what happens to these people? Yes. So
unlike other forms of maybe pension, whereby you get to take your money after, the law that established the Ondo State Contributory Rights Commission forbids us refunding you of premium payment. So, but what we do, we have a system, the HIS, where we take the data of all our enrollees, both formal and informal. Once that system picks your name that you have not accessed care for 24 months, 2 years, unbroken period.
Okay.
We will reach out to you ourselves.
Okay.
And then we'll ask you to come and do certain investigations that are specific for you at no cost. We'll consider your age, we'll consider your demography before we'll say, okay, come and do this. So once we see that you have not accessed care for 2 unbroken years, we look for a way to reach out to you and give back to you in a way, in the form of laboratory investigations.
Okay. All right. Because I know lots of people, they will feel like they are being cheated, like, why am I paying for a service and I'm not enjoying the benefits? So I think this clears it up. So still on the 60-year celebration, are there any packages or benefits that the Ondo State residents are going to benefit?
So we are doing a lot. This week we are on Tuesday we had a press conference at Adegbemile NUJ Center at Adegbemile. The following day would have the Dawn Commission. There's an agency for for developing or Western region and area. So we have a conference, a health insurance conference, that will take place at the Dome, on Wednesday and on Thursday. This is targeted towards, the team is actually attaining universal health coverage through a strengthened health insurance. So these are conversations that we're going to be having on how we can improve health insurance across the state. So this is, in a way, is going to benefit the resident of Ondo State, because this is a way of strengthening the health insurance landscape, not just in Ondo State, but in the southwestern region of Nigeria. And another thing we are doing on Sunday, of course, this Sunday we'll visit Winners Chapel along Ondo Road for the Thanksgiving. So we're doing a lot this week just to celebrate, but even in celebration, we are also giving back to society. We are going to be doing medical outreaches. Next week we're going to be having a medical outreach, and we are going to be having a road show.
A road show?
Yes, along Arakale Road. We're going to be having a road show. One of the parks there, there are two parks there. In one of the parks there, we're going to be having a road show, where we're going to be doing free medical outreaches to people. And then we're also going to be enrolling people, for the informal sector now.
Yes.
We're going to be enrolling people. You can come there, pick a form, make your payment, buy the Orange Health Insurance Scheme for the informal sector. So we're going to be doing a lot. We're giving back to society, and we're also doing so much.
Okay. I think we've actually said a lot, and I'm very sure a lot of residents, they would key in either to the Abiyamo or the BHCPP or Oranghis itself. Just look for the categories you fall under. Are you a pregnant woman, vulnerable pregnant woman that needs healthcare facility? Are you vulnerable? Are you physically challenged? Just let them know what category you fall under, and certainly you will be registered. Do you have any comments or advice for the people out there?
My advice for the people is health insurance is the way to go. In all sincerity, assessing healthcare now, treatment of common malaria, you spend much. You spend between 3,000 to 5,000 in taking care of common malaria. Now imagine your child falls sick, the wife also falls sick at the same time. What are you going to do? But if you pay this premium, key into the health insurance that we're preaching, if you pay a premium of 18,000, 36,000, you're covered for the whole of the year, and you do not have to bother, you do not have to think about it. All you just need to do is visit the facility, present your ID card if you're in the informal sector, and then they will attend to you at no cost, at zero cost. So I need to clarify also that unlike the NHI scheme that we all know, that you get to is a co-payment. You pay 10% of the amount. Orange Health Insurance Scheme is a non-co-payment method, so you do not get to pay a dime once you visit the facility after the initial premium payment of either 1836 or 90,000 naira per policy year. So key into your health insurance plan today. That we say it is Naira wise, health smart. That's our slogan at the Ondo State Contributors Commission. So be Naira wise, be health smart. Buy a health insurance plans for yourself today. Thank you.
Okay, let's take a quick look at the pensioners. What category will they fall under? Do they fall under the BHCPP or under the informal sector of Oranghis? So
for the pensioners, NUP, they fall under the informal sector. Why? Because exactly we do not get to deduct their salaries again automatically. So, and we have been engaging them about about a month ago. We were at different centers across the 18 local government of Ondo State. We visited those centers to sensitize them, because they were having their verification and the Ondo State government was making identity cards for them, for the pensioners. So we've been engaging them, introducing the gospel of Orange Health Insurance to them, so that they can key into the informal sector. Okay, and coming through their organization. Yes, NUP, Nigerian of Pensioners. I think that explains. So we are engaging them to the end that they can key into the informal sector plan. So they just pay a certain premium. Of course, it could also be flexible. We can look at how we can deduct from their salaries directly. We are having those conversations with their executives to the end that premium payments does not really so much become a financial burden to them. Thank you very much for coming. I hope next time when we call, you would answer. It's always a pleasure to be here. Okay. We've come to the end of today's edition, and I would say thank you all for joining, and we'll see you next week.